everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with the help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I'm Sarah Duval, one of the co-hosts of the podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy at www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Carol Anne Poursaied, Senior Practice Development Manager with Zeiss, about the importance of patient counseling and education and the top 5 mistakes practices make that affect their conversion rates. Let's jump in. Before we get started, Carol Anne, why don't you take a minute to tell us about yourself? Who are you? How did you get into ophthalmology? Tell me your story.
Awesome. Thank you, Sarah, so much for the invitation. I am thrilled and excited to be here and to talk to you about patient counseling today. So I got my start in ophthalmology back in 2010. After being a stay-at-home mom, I entered the workforce again as an OD liaison and a marketing manager. I kind of worked my way through a lot of jobs within the clinic, and we launched a lot of new technology, and I got recruited away by industry. And in 2017, I started as a practice development manager with Carl Zeiss Meditec. And my job is to raise awareness, education, and grow smile volume in the United States. So I'm happy to be here and share what I've learned in the past 6 years.
Awesome. Well, I think this is going to be a great conversation. So can I get started?
Absolutely.
All right. So we're going to talk about some of the pitfalls, I think, maybe the 5 mistakes that practices make when it comes to patient counseling. Okay. So the failure to learn the patient's why now and motivation, you think, is probably one of the top 5 pitfalls. Why is that?
So I learned before we started recording here that you had a role as a counselor in refractive surgery. And I'm sure you can agree with me, Sarah, that not one person has ever walked through your clinic because they were looking for a LASIK flap, a lenticular extraction, or a surface treatment. They've come here to solve a problem, and they have some goals. And some things in their world has recently changed, because if you woke up this morning and you had a kidney stone, would you be recording this podcast with me?
Probably not.
Absolutely, yeah. You'd be seeking out some medication at a hospital because you have an acute problem. Well, these patients have a problem. It's just not acute. And last month, they didn't call your clinic to reach out and learn about the options and treatments, and they might not call next month. We need to capture these patients at that moment, that point of pain, and learn what their problem is and let them know that we have a solution to their problem. There's a saying that, patients don't care how much you know until they know how much you care. And that's part of this journey, is letting them tell us what their motivating factors are.
So you mentioned that I did a stint as a refractive surgery coordinator. It's been quite a number of years now, but back then, oh my gosh, it was something, I think the figure was something like it takes the average person, is it like 4 years, 6 years from the time that they start thinking about it till the time they actually have the surgery? Is that accurate?
I think it's lessened a little bit. Or now we get data between 12 and 18 months, but that's still a long time to make a decision.
A lot less than back in 2001.
And I think part of that is to the advent of the internet. We have so much more information available at our fingertips now that we don't need to seek out, go into doctors or go into the library or waiting till a publication comes out. So it's lessened, but it's not an overnight decision.
Okay. So that is still, and that can still seem like a frustrating amount of time, right, for those of us on the practice side, thinking that we had this lead. Why aren't they doing it? Right. Why aren't they doing it? Why aren't they calling? Why aren't they booking? So number 2, not uncovering potential objections. Let's talk about that.
So we meet with a lot of counselors at times, and we'll hear stories that, this patient didn't book, and you say, well, why not? And they're like, oh, they needed to go home and talk to their spouse or, their best friend, or they need to check their schedules or see if they get approved for financing. So it's important, we don't like to think that we're doing sales in medicine, but there is certain part of being a counselor that is sales, that we need to get this patient to the next part of their journey. So it's important to uncover these objections before we're asking the patient to schedule and before they're brought up. So some of the things that we can do early on is having the counselor greet the patient in the waiting room, set expectations, and welcome them to their clinic. If you're meeting with somebody and the first time you meet with them is at the very end of the consultation, what do you think patients see that person as?
Money. Yes.
I'm the money person, and we don't want the counselor to be perceived in that role. We want them to be the hand holder. We want them to be the guide to get them to that next step of the journey. So one of the things is, again, meeting the patient in the waiting room, setting expectations, doing warm hands off, but maybe you can take the patient on a tour of your laser room. And this is a great way to ask some of these questions of, so Sarah, is this your first time having a consultation? Well, this tells you a lot of information. If they say, no, this is my third or fourth, well, are they price shopping? Do they not like the clinic? Was it something about the technology? When you ask them to, how long have you been thinking about this? Well, I've been thinking about it for 3 years. Well, what's been holding you back from proceeding? Well, it's going to be time, fear, or money. So when the patient lets you know, well, it's money, but now I've got a new job, we know that that's not going to be a challenge for us, is booking because of finances. But if they say, well, I've just been really, afraid that I might not be a candidate because I have a lot of astigmatism, or maybe I'm just so afraid of going blind or that it's going to hurt. Well, we need to know that our consultation needs to focus on education about those fears, and we don't have to focus on price. Or if it's the other way around, well, I don't know if I can afford this, but I'm spending so much money on my contact lenses, then we can kind of direct them, direct the consultation in showing the value of laser vision correction and the affordability. And then, of course, we do the education and overcome fears of the procedure, but it's not going to be the focus. But we need to ask these questions up front, so it's not on the back end that we're brought up with these objections.
So you mentioned time, fear, and money. Which one in this day and age do you think is actually number one?
I personally think it's fear.
That's actually what I would have guessed.
Yeah, I think there's money challenges, of course, with economy. But I think right now we have some information that only 5% of patients who are eligible for refractive surgery proceed with it. And I walk around and I see I travel a lot. I see plenty of, high-end purses, people taking luxury vacations, lots of nice cars out there. When you can create a value for something, people will find a way to afford it. So I think there's a lot of just a fear out there of, like I said before, people thinking it's going to hurt and going blind in the parts of the recovery, and just the fear of somebody touching their eye, that we need to overcome and educate patients about that, how simple it is. Because I'm sure you've heard this before. What's the thing that you hear the most common after patients come in at their 1-day post-op? I wish I did this.
I see. I'm sorry. Oh, the fear? Was that?
I wish I did it sooner. Why did I wait so long? Yep.
Yeah, but they're just ecstatic, right? Yeah. The same things a lot of times, sometimes with cataract surgery too. I wish I had done it sooner. Anyway, I feel like with the internet, as good as that can be in terms of helping to educate people, it's also probably a double-edged sword, because there's so many horror stories on the internet. So when I asked you the question, time, fear, or money, my thought was that you were going to say fear, and I was thinking it's probably thanks to the internet. It's fear.
Absolutely. Yeah.
Okay, so we're ticking off the top 5 here. So the next one I have for you is, well, we kind of started talking about it, but making the price more important than it is. So
have you recently bought a new car?
I have, actually. Back in May.
So when you walked into the dealership, did the salesperson just sit you down and start talking about money?
He did not.
No. The first thing they want to do is they're going to put you behind the wheel. They want you to love the style, the feel, the luxury, even the smell of that new car before you start discussing payments. Nobody who comes into a clinic thinks laser vision correction is free. So as we said, price is important, but it's also important in the way we present it and discuss it so that we can change the focus of the consultation. going back to the part about the value, we need to show these patients that there's a value in having laser vision correction, not that it's just the cost of it. How is this going to change their lives, enhance it? Contact lenses are expensive, glasses are expensive. So we can solve that problem for these patients. And ultimately, we have tools that we can show them over time how they're going to save money. But there's importance about how we accomplish this.
Mm-hmm.
So one of the things I'm going to recommend is, either you want to stand out. You either want to be the cheapest or the most expensive, because when you're stuck right in the middle with price, you just become part of the noise. So going back to handbags, a very expensive luxury handbag does the exact same thing that a lesser one does. It carries your keys and your wallet and your chapstick. Okay. But people pay that kind of a money because there's a perceived value behind that. And we need to show patients the same thing. And what does that value in the clinic look like? Well, it's your patient experience. It's the experience and the results that your doctor is getting with their procedures. And it's the technology that your practice has invested in. And I'm always very careful that I teach counselors and even the call center on the phone to use that word. Our practice has invested in the most advanced form of laser vision correction. Because if somebody else isn't offering this new technology, it's not because the technology is inferior, it's because they haven't made the same investment that your clinic has. So make no apologies, own it, and deliver on that first-class experience and differentiate your practice with that technology, such as Smile, patient experience. Maybe you even offer Saturday appointments or evening appointments, virtual phone consultations. But when you can deliver on that, price becomes less relevant. Yes, it's always going to be a part of the equation. People have to pay for it, but we can work that part out. Once they get in the clinic, that's just a part of the problem solving. It's not the main issue.
Okay. I mean, the reality is that there's always going to be people that you're not going to win over.
Exactly. And Sarah, part of it's too is how you present the price too. Okay. So if a consultation's finished and as a counselor, I go in and I just have a folder and I say, the very first thing I do is say, well, here at our practice, this is the cost of this. Then again, the focus goes on the cost. But we want to we also almost want patients asking us, well, can you tell me how much it is? Because that means we've overcome all those other objections of the fear, the recovery, and the time. And now they're ready to know, let's talk logistics. So we recommend that we present price in a way such as, so Sarah, your investment for your lifetime of better vision is $2,450 an eye. But you know what? Most of our patients use our 24-month interest-free financing. I'm so proud that we're able to offer that option to our patients. And you know what? That makes their monthly payment just around $204 for both eyes. That's pretty much what my husband spends a month on the premium coffee, down the street. And then this is the hardest part of the job, is to stop talking. Whoever speaks first in a negotiation typically loses. And that silence is awkward, but it gives your patients time to process what you've just shared. Remember, they're hearing this for the very first time. You say this maybe 8 times a day. Maybe they're thinking, oh yeah, this is too expensive for their budget. But they also could be thinking, oh wow, I can use my airline credit card, get the miles, and now I can take a free vacation and go scuba diving because I don't have to wear my glasses. So we don't know what's going through their mind. So let them process it. And if you must speak first, then your conversation should start. So Sarah, tell me what you're thinking. And honestly, we could do a podcast on just this one topic.
Maybe we should follow up.
Yeah, but really present it. The last thing they're going to remember is the last number, and $204 a month is way less expensive than it's $5,800. So make it something digestible. Most people live paycheck to paycheck, and they have a monthly budget. We don't typically just buy things with big price tags with cash.
Very true. I like that. And I did not know that tidbit about the negotiation thing, about whoever speaks first typically loses. I'll remember that now. All right, Carol Anne. Assuming the patient knows as much about laser surgery as you do, that's another negative.
Yeah. I think back of the first day on a new job. What questions did you ask of the person who was training you? It was likely, where's the restrooms? What time is lunch? And how do I log on my computer? It wasn't, well, can you tell me what the KPIs are for this position? Or where can I get the data from our year over year numbers? And it's not because you didn't care to ask that. It's because you didn't know. It wasn't the main focus at that time. And the same with patients, Sarah. What they do is they typically come in and their first questions are maybe about price and scheduling. And it's because they don't know to say, I'm calling to see if my corneas are thick enough based on my prescription to see if I would be a healthy candidate for laser vision correction. Or can you tell me what the benefits of SMILE are or LASIK? Or how long should I be out of my contact lenses? So it's up to us to guide these patients and let them know what this process looks like and what they need to have a good result and outcome. So don't assume that because they're not asking questions, they know the answer to this.
Okay. All right. I think this last one here is probably this is my favorite one because I could not agree with this more. And this goes for many different parts of the ophthalmology practice. Failure to make a firm recommendation. So important to make that recommendation.
I always ask doctors and counselors, I'm like, do you ever go out to eat and ask the waiter if you should be having chicken or fish? Or if you're buying jewelry and fine diamonds or gems, do you talk to the jeweler about a recommendation? It's of course, because they're considered experts at the moment. And in refractive surgery and cataract surgery or any type of medical treatment, you are the expert. Nobody woke up one day. You might wake up and decide to go browsing in the mall. But nobody wakes up and goes, you know what? I haven't gone for an eye exam in a while. I want to see how thick my corneas are, what my topography looks like. Patients who walk through your clinic, they have an active intent of learning if they're a candidate for laser vision correction. So I tell counselors, by the time a patient is in your waiting room, it's really your patient to lose at that point. It's not that you really need to convert them. They're making a commitment. Maybe they've been out of contact lenses for a while. Maybe they're considering having that dilated eye exam today. They are ready and right for you to get them to that next step. So when a patient comes in and they find out that, you're a candidate for, all three types of laser vision correction or all three types of lens-based surgery that we offer, you'll do great with any of them. There's just a little bit variance in the recovery. Let me know what you think. Well,
wrong answer from the
So what does your patient do now at this point? Do they go
They're so overwhelmed? Like, well, I want you to tell me. I don't know.
Exactly. So it kind of goes back to number 4 when it was about the education part of it. So it's our job to treat each patient as we would a best friend or sibling. And I'll even say to doctors, if your sister came in here and wanted refractive surgery, would you tell her like you can have any one of these options? No, you would make a recommendation based on her anatomy, her scans, and her goals. So having things like eye models, some visual tools, maybe videos that you've even personally created in your clinic to make a personal connection, show those videos, because once a patient walks out your door, we hear you only have about a 35% chance of getting them back on your schedule. So once they leave your clinic, you no longer control the narrative. Like you said earlier, YouTube does, the internet, word of mouth. I mean, the crowdsourcing of people who go onto TikTok and, ask opinions of people who are not qualified to make those recommendations. And I used to tell patients,
isn't that wild that people actually do that? I can't even.
I was a counselor for years and I did a lot of cataract counseling, and patients would say, well, what do you think I should do? Especially when it came to premium lenses. And I would just make a joke. And I said, I got my medical degree from the University of Google. I did my fellowship at WebMD. And unfortunately, our state does not allow me to make recommendations based on those criteria. So let's go back to the doctor. I'm going to put the responsibility on the surgeon here, or the optometrist who's ever doing the workup. The patient needs a recommendation, and then just follow it up with, I'm recommending, LASIK because this is what best falls in the parameters of what we can safely treat. I'm recommending Smile because I see that you have a very active lifestyle and then you probably want to get back to these activities. I'm recommending PRK because you have thin corneas and this is really the only treatment option that we have available. So make a recommendation, follow it up with a reason, and then you'll do a blessing for your counselors to get them to the next step of being a happy patient who sees better.
So in your experience as a counselor and in your role now with the practices you work with, do you find that there are a lot of physicians that aren't making recommendations, or is that really few and far between?
It's a small percentage, but it's a big enough, it affects their bottom line, because again, these patients now, a confused buyer doesn't buy, whether it's a washing machine, a car, or considering an elective surgical procedure. They need to know that the surgeon, making that recommendation shows the confidence in the surgeon. That, we did a lot of scans today. All of these numbers look perfect. Everything aligns. I think you're going to do great with any one of these procedures, but I'm recommending this one because, and own it. And the patient will have that confidence and be like, Dr. Smith said I need to have PRK.
I can't imagine physicians not actually making a recommendation. Like, I can't imagine there are some out there that don't. And even so, I also, when Carol Anne and I were talking before we started recording, and I told her how I've also done a stint as a cataract surgery counselor, and so part of that was the premium IOLs. And even with that, I always used to tell my docs, you need to make the recommendation. You cannot just tell them, well, you have enough astigmatism that you would do well with a toric, and then send them to me. You can't do that. They want to know what you are, their doctor, especially those who have seen that doctor for years and years and years. They're a trusted advisor, right? They want to know what you recommend firmly, not wishy-washy, not what Sarah thinks, what you recommend. I don't think you can stress the importance of that enough, really. And that goes really for anything in ophthalmology or any area of medicine, really. A recommendation for anything, whether it's, cataract surgery or LASIK surgery or crosslink, I don't know, whatever. The point of the matter is doctors need to make firm recommendations.
Yeah. Exactly. So hopefully we can change the mind of a few people by listening to this podcast and help more people see better.
Yes, hopefully. So if you are listening and your doctor is wishy-washy and does not make a recommendation, if you take nothing else away from this podcast, takeaway number 5, that's one really easy thing that can be changed quickly.
Absolutely. Yeah.
Other things could take some time to right the ship and to try to change the conversion rates, but that is probably the easiest one, is to just have that conversation with your doctor and say, listen, they shouldn't be coming to me with their options without a recommendation.
Right. Yep. For sure.
All right. Any other thoughts, Carol Anne? I mean, we talked about some negative things that can be turned around in practices. Do you have any other thoughts about?
Sarah, I think there's so many things that we can do in the counseling realm, but millennials and Gen Zs, these are very experiential buyers. We've had data that shows us by the time a patient walks into a door of a clinic, again, refractive surgery, elective here, that they've done 70% of their research. They've been on your website, they've been on your social media, they've read your reviews on Facebook and Google. They've talked to their optometrist, they've talked to their friends and family. When they come to your door, what they're trying to find out is, do I like and trust these people? And we just can't treat these patients like we would for somebody coming in for a 3-month IOP check. We need to make sure that there's some type of connection. And I always tell counselors, I'm like, think of things that you do, whether it's have your car serviced, where you go to hang out for, a favorite pizza joint or get your nails done. You might drive past 3 or 4 different vendors because you have a place that you go because you like and trust these people. That's what your patient's coming to find out. And you can only do that by asking questions and showing them that you care.
I love it. I think that's a good note to end on.
Yes. Awesome.
Yeah,
wow, that time went by super fast.
It did. I know. It was a really good conversation. I think that people are going to get a lot out of it. So thank you so much, Carol Anne, for joining us today and talking to us about the importance of patient counseling and education and the top 5 mistakes practices make that affect their conversion rates. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, kindly share it with your friends and on social media. Also, please don't forget to write a review on iTunes or Google Play. Your reviews will help other doctors and practice owners to find us. Till we meet again, wishing all of you an amazing week ahead.